Everyone can be heard. Okay. Thank you everyone for attending today. My name is Christine Apple. I'm co-chair of the Mental Health Task Force, and I'm a psychologist with the Department of Corrections. And I believe Mary Neubauer is going to start the meeting.
Good afternoon and welcome. I'm Mary Neubauer, public policy consultant to Mental Health America of Wisconsin, and co-chair to the meeting and representative to the Milwaukee County Mental Health Board. And speaking of mental health, I'm celebrating my mental health today with the championship of the Milwaukee Bucks and the positive effect that it will have on the Milwaukee County budget by wearing my championship shirt today, and how much I enjoyed my time down in the Deer District and watching the games. So on behalf of the Mental Health Task Force, we'd like to thank County Exec Crowley and the speakers for joining us today to update us about the 2022 county budget and address our questions. We invite everyone to join us on September 14th for our annual Care and Avery Forum. This year, our theme is celebrating recovery, ending stigma, excuse me, and embracing possibilities. Our forum will identify opportunities to address substance use disorders as a public health concern and normalize harm reduction strategies. Registration is available on our website, and the link is in the chat. Also, the Mental Health Task Force membership drive is currently active, and a reminder that we welcome and need your support for our annual membership drive. We'd like to thank individuals and organizations who have already responded. Materials are posted on the website, and you can count on us to keep you informed. Please become a supporting member, and I would like to add that we really count on member contributions, and we look forward to having new members become part of the membership community of the Mental Health Task Force. And Barbara, I'd like to turn it over to you as the Make It Work Milwaukee Coalition.
Thank you, Mary. I'm Barbara Beckert with Disability Rights Wisconsin. Mary, if you just want to mute, I think you're getting a little background noise. Great, thanks so much. Everyone, thanks for your patience with the virtual world and the technology. I wish we could all be together. Anyhow, as Mary said, I help to staff the Mental Health Task Force and the Make It Work Milwaukee Coalition, which is cross disability and aging. And wanted to note that we're gathering here today on a really important day for the rights of people with disabilities, older adults, and all people in Wisconsin. Today, Governor Evers vetoed a number of bills that would have created new barriers for voters in Wisconsin, bills that we opposed. And it's really a reminder of the importance of advocacy, because if it wasn't for Governor Evers' veto today, those bills would become law, and we would have even more barriers for people in our state to cast a vote and be part of the democratic process. So that's one of the reasons why we're so glad you're here today as we look at the budget process for Milwaukee County. It's a very important time for advocacy. We're really pleased to have the county executive and Director LeGrant McLean and other leaders with us today as we really look at a pivotal time in Milwaukee County as we make changes to our mental health system that are so significant. So we want to thank our speakers today, and we hope that we can be a resource for all of you who are in the meeting as we move forward with the budget process and every day as we work together to support recovery and improve access to services in Milwaukee County. Nothing about us without us. I'm gonna just mention a few meeting logistics. We have interpreters available, ASL interpreters. If you need an interpreter and you need any tips, just put it in the chat and we can help to connect you. We also have captioning available to make our meeting accessible. If you want to turn off the captioning, you can do that with the CC icon on the bottom of your screen. Right now, everyone is muted too. We do hope to have the opportunity for some questions from our speakers. So we ask you to please note your questions in the chat. I'll be monitoring that, and we'll try and have our speakers cover as many as possible. So those are our meeting logistics. I'm going to turn it over now to our co-chair, Dr. Christine Apple.
Hi, everybody. I just want to add one thing to that. Sometimes people inadvertently turn off their mute button, which we all do. And today we have feedback when that happens. So I'm going to politely private message you in the chat if that happens. And so that will be it. But now, without further ado, it's an honor to welcome County Executive David Crowley. County Executive, thank you for your commitment to advancing racial equity and the strong support you have expressed for mental health services, housing and disability services. Please let us know how the Mental Health Task Force can serve as a resource for your administration. Thank you again for coming today.
Well, thank you so much. And so I'll go ahead and kind of give a high overview of what we have been doing so far, and then allow Director LeGrant McLean to come and step in. But first and foremost, good afternoon. I want to say thank you for having me. I have to say that, just going off based off of what Mary just said, I have been coming off a whirlwind of 2 weeks. I've always been a lifelong Bucks fan. So that was great for that. And you would have thought I would have won, because after that, I just got back from taking my family to Disney World because they were desperately owed a vacation with the past 2 years that they have endured. And so as we think about this budget, I just want to say that many of you may be aware that we are facing another tough budget, but this is where we need to make sure that we are making smart decisions with the taxpayer funds and to keep the county's fiscal future in mind. And so when you think about this year, Milwaukee County is facing approximately about a $21 million budget gap. And when we look at our preliminary revenue loss estimate for last year alone, our lost revenue is estimated to be up towards about $94 million. And that's due to the ongoing impacts of this COVID-19 pandemic. And so last year, we were able to be successful in ways where we were able to navigate a difficult budget based off of the sacrifice that many of our departments made, as well as our employees, and also thanks to the CARES Act dollars that we received from the federal government. And so we were able to pass a budget that helped us stay true to our vision of achieving racial equity and really becoming the healthiest county in the state. And I'm really proud to say that despite all the challenges that we all have endured the past year, we were able to remain focused on our vision to achieve racial equity and become the healthiest county. And so we want to continue to stay committed as an entity in driving out hate, dismantling systemic racism in our institutions, and honestly seeing the humanity in all of our residents. And so this year, the federal government sent the ARPA funds to local governments to help aid us all in the economic recovery, and really to help continue to keep residents as safe as possible as we work to end this pandemic. And so we're receiving about $183 million in ARPA funds. We've already received our first tranche, $80 million, and we're receiving a second tranche at the I want to say fall of next year. And we really have until 2023 to allocate these funds in order for us to respond to the public health crisis, make sure that we're taking care of the essential workers' needs, as well as reclaiming a lot of our lost revenue as well. But when you think about the county, our projected revenue loss through 2023, it's actually in the range of approximately $300 to $400 million. Okay, and that far outpaced the federal funds that is available to us. And so it's a helpful boost to us as it relates to the recovery, but this is not going to solve all of our financial issues within Milwaukee County. And so while we do have the authority over how we're going to spend these ARPA resources, there are some constraints on how it can be spent. So much of our spending will have to be focused on costs that we incurred as a result of this pandemic, including, COVID-19 purchases, COVID-19 related revenue loss, but as well as community and economic support programs, making sure we can distribute the vaccine equitably, as well as getting people tested. And then when you think about the IT and the remote work related investments that we've had to make. But, we do have the ARPA's task force that was championed by the chairwoman, which will be getting this work this week, if I'm not mistaken, this Thursday, to really engage the public on community needs and to help make recommendations to the County Board of Supervisors on how we're going to spend the funding that we have received so far. And so I've designated Ricardo Diaz, who's the former head of the United Community Center, to represent my office on this task force. And there's no doubt in my mind that not only him, but those also on that task force will do what needs to be done. But again, we are working to navigate a structural budget deficit gap, which has really been created by state imposed funding limits and the growing cost of mandated services. And I know many of you have heard this time and time and again, but we have to continue to talk about it because it is real for us. Because in the past 10 years, we've closed a structural gap of $300 million by expenditure reduction. And so we found efficiencies, we've streamlined services. You know, people would say we've made government leaner when you think about the $30 million also on top of that. But without a solution to our problems, in the next 6 years, we will not be able to offer services like we do offer for like our parks, our bus routes, our emergency services, disability services, senior services, public safety, and youth services. And so to solve this problem, we can't continue to cut ourselves out of this because it's not possible, nor is it sustainable. So we have to do something. We've cut to the bone. And so we need to really raise revenues to avoid the fiscal cliff that we're going to see in 2027, where we'll literally have no local funding for our local priorities. And this includes transit, meaning all of our money will be going to just state mandated services. And so one of the things that truly believe is going to be a sustainable, also a long-term solution to this budget is to give us the ability to have a local option sales tax. And so, you know, this is something that we would use to both decrease our property taxes for owners, property owners, but this is also going to help us fund local priorities. And we've built a coalition and we're gaining some steam, not only just here locally, but as well as in the state legislature as well. This is with the GMC, with the MMHTF, the city of Milwaukee, and we've been building a coalition for folks around this idea. And so when you think about it, the sales tax can help us generate a 1% sales tax at the very least, county-wide, will help us generate about $160 million in additional revenue, really matching the scale of the issue at the lowest cost to taxpayers with no budgetary impacts on the state budget. And so this is a viable solution for us. And we would use this, again, to offset some property tax relief, and then we would use the remaining revenue, which would be split by the county and all the other municipalities throughout the county. And this is something that we should do because, you know, the city of Milwaukee and all the other municipalities, we make up the economic engine of the state. And we want to continue to remain an economic asset. But this is going to require investments. And I think when we think about what we just seen with this Bucks run, the amount of dollars, the amount of people that came to the Deer District, that came into the city of Milwaukee, or that patronized their local restaurant, local business, this could help us keep many of those dollars here and do what we can to make sure that we're taking care of the people that matters most. But we are also looking at the data as it relates to COVID-19. And as many of you see, we're seeing some alarming rates as far as the increase in infections due to this Delta variant that we have seen within this past month. And so we've had a mask mandate in place for many of our visitors because we deal with some of our most vulnerable populations. But we recently issued an updated administrative order to tighten up our mask rules, particularly for county workers inside county facilities, vehicles, and services as well. And so, you know, the vaccine distribution continues to be our best tool to ending this pandemic once and for all, and completely reopening all of our businesses so we can fully recover from this pandemic. But we're going to continue to do everything that we can to get people vaccinated. And so we originally in March rolled out a zip code program to allow some of our most vulnerable zip codes to get vaccinated. In May, we launched our Healthy Homes program to focus on those who can't leave their homes because many of those folks weren't getting the proper information, or we're getting folks to come out to vaccinate them. But we also partner with the city of Milwaukee as well to create the community vaccine mobilization program, which we launched in early July to go door to door because we can't throw anything off the table when it comes down to making sure that people are getting the information that they need in order to make an informed decision if they're going to get this life-saving vaccine. And so we've gone through so much due to this pandemic. But I will say that we've also learned that, our community is a resilient one. And when we work together, we can persevere through all the great odds that are against us. And I truly believe that we will do so again as we work to end this public health crisis, as we see these numbers come up. But we have to continue to ask ourselves and those around us to get this vaccine if they can, to protect themselves, to protect their family, and protect all of us around them. And we have information for them. So if you know anybody who is still on the fence, I'm always use the opportunity to promote the healthymke.com website so you can learn more about the vaccine or to find a vaccinator or testing site near you. But I would like to open up for any questions or allow for Director Shakita LeGrand to come up if she has any words to say as well.
County Exec, in the chat, there are a few questions. One is, will Milwaukee County require all county employees to be vaccinated?
So we have not done that at this point. So what we have done so far is we've created a vaccinate program, right? And so we're allowing all of our employees to actually upload their vaccination card or where they are in the process. And we're asking for that information by the end of this month or early next month. So we have a sense of who has been vaccinated when it comes down to Milwaukee County employees. I want to say maybe about 2 weeks ago when I seen the updated numbers, almost half of our employees had actually updated, letting us know if they have been vaccinated or not. And so we want to be able to use that data to figure out what's the best way for us to move forward. But we have not got to that point yet because it seems that many of our folks are vaccinated, but we want to be able to see the data.
Thank you. Another question we hoped you would address when we had the opportunity for dialogue for you when you were a candidate, we had shared the concerns about the accessibility concerns at the COG Center and the barriers for that building, both in terms of accessibility, but also just in terms of people feeling welcome and respected, because it's extremely difficult to enter and to navigate. And I know you had hoped to move away from that building. So I wondered if you could comment on that.
Well, I think, Director LeGrand, I'm assuming you're going to have some updates related to the COGS building, but we actually have some long-term planning as it relates to the COGS building and actually keeping that building and staying there, but it's going to take some work. But I believe Shakita will be able to talk about that briefly.
Reverend Elwanger, I think that you had a question. Oh, is it in the chat right now? Oh, he's quick. Yes. You've supported a full-scale mental health treatment court in Milwaukee County. Will you include the $150,000 in the budget that's needed to support a court for a year, enabling close to 100 people to stay out of incarceration and instead get treatment and stay in the community?
A really good question. This is something I definitely do support. But we have to make sure that we continue to work with the courts as it relates to that, making sure that they have a judge available. But we're going to continue to have these conversations throughout the budget process. Great question.
Thanks. Another question that had come up in the steering committee in preparation for this is, with the task force that you mentioned, wondered, is there representation at all from the mental health and disability community on the task force? And if not, what will be the opportunities to provide input on how funds are spent? And I know there's also a lot of interest in the opioid settlement and how those dollars will be used, and would love to have the opportunity to be a resource as those decisions are made.
For sure. So as it relates to the task force, the ARPA task force, this was a resolution that came directly out of the county board, and they only put so many people on there. So we put, again, our designee, which is Ricardo Diaz. I don't believe that we have anybody explicitly from the disability community on this. But what I will say is, come to the task force, make your voice be heard. This is a very small group of individuals. As far as my office goes, we only have the ability to put one person on this particular task force. But I think it's critical that as we let folks know when we're going to be meeting and holding public hearings, that you let your voice be heard. When it comes down to the opioid dollar settlement, we're still in the very early stages about what's going to be happening, how much of those dollars are going to be coming directly to Milwaukee County. We do know that there's going to be a 70% split to counties and 30% is going to be going to the state, which is really an unprecedented amount of dollars that are going to help us out. But these dollars has to be used towards opioid related events. So when we think about making sure that whether we're talking about preventative measures or just going in and helping somebody out who's currently having a crisis. But we are going to be going to the public to find out other ways that we can creatively spend these dollars to make sure that we are staying ahead of the curve as it relates to the opioid settlement.
Thank you. Other questions for County Executive Crowley? This is a great opportunity, so. Reverend Elwinger, didn't you have another question? Hate to come back to you, but I know you had some opportunities. One of the areas that we're all concerned about is the future of the youth justice system. You know, we want to make sure that our youth are not stuck at Lincoln Hills and Copper Lake, far away from families and community supports, but also knowing that the proposal from the legislature is not moving forward as anticipated. And I mean, the facility is supposed to be closed, but there's no plan B in place. So what's your plan B?
Well, our plan B is we want to keep these young people as close to their parents, their families as possible, to close to their support group networks as possible. So for us, we want to stay ahead of the curve. You know, I was in the legislature when, you know, we passed Act 185, and, you know, I was a part of the deliberative body that helped craft that legislation. And I'll be one of the first to say it's disappointing that Lincoln Hills is still open, and it's been the political football that it has been for the past year and a half, almost 2 years. And so, you know, we are reimagining what we can do right here within Milwaukee County. We know that instead of spending, and I think we just was recently actually reading a JS Online article about this, you know, because we are sending less young people to Lincoln Hills, it's costing more to send young people there. Now, if I'm not mistaken, I think the daily rate is just topped over $1,000 a day. There's much more that we can be doing with $1,000 a day in the community versus having these young people in Lincoln Hills. So we're going to continue to do what we can to rehabilitate these young people right here within Milwaukee County without them having to be incarcerated.
This is Cindy. I don't know how to use the chat, so I'd like to ask you a couple questions from on the people first part of it. We have concerns about people with mental health that get sent to Winnebago, or they get sent, and you know, I think, you know, instead of, we want the police department, I guess, to make sure that they're trained to how to help people with intellectual disabilities that have mental health. They have two diagnoses. They have two diagnoses. Howard, you said a dual disability plus mental health. And what we've heard is that I wrote a letter that was not to you, but, and my concern is they are sent to Winnebago on a long ride up to Winnebago. I mean, why can't we have crisis centers down here in Milwaukee, and they get to know somebody down here in the crisis, and then they don't need to be sent anywhere. We don't want people, first, do not want them incarcerated, and we don't want them sent to Winnebago or any place, but to get them help here in Milwaukee first and see what we can do to fix the problem. So thank you for listening, County Exec.
Well, thank you. I truly agree with you. When you think about it, at the end of the day, this is an issue of access. And all across this state, a lot of people do not have access to services that they absolutely need. And so we have been talking about this at the state level for a very long time, but it's really about making sure that the state is really putting their money where their mouth is. If they want to save money on the back end, you have to make front investments. You have to start investing upstream. And that means investing in mental health all across this state.
And can I just ask one more question before we go on? How much does it cost to send a person, put the person, of course, I don't know how far Winnebago is. I know it's by Madison. How much is that costing us to send one person up there, with police and everything else? What's that costing us? Please and thank you.
I'm not sure. I don't know that number off the top of my head. But what I will say is that this is an issue that is shared amongst both city and rural areas. So when you think about it, if you think about somebody who's living in La Crosse and somebody's having a situation and they need to go to Winnebago, that's about an 8-hour ride, right? I mean, that's a full day for that police officer. So it's definitely affecting local municipalities' budgets. And so I totally agree with you, but this is an issue of making sure that we're putting the resources where they need to be.
Thank you very much.
County Executive Crowley, it's Mike Lappin speaking. I can answer the question very briefly. We do have a specialty crisis mobile team that serves people who have intellectual disabilities and also experience mental illness. That team goes out and gets to know folks. Many of these people we know and have crisis plans. And that team works very hard to keep people in their residence, in their place that they're happy and doing well. We do not make it a practice of sending anyone to Winnebago. That is something that does happen around the state, but does not happen in Milwaukee County because we serve our customers locally here at our BHD hospital and our other community resources. It is a problem statewide for sure, but that's something we've been able to avoid here in Milwaukee County. So sorry to interrupt. I just wanted to make sure that was clear.
Thank you.
Well,
thank you
so
I didn't
much.
even know that. Thank you.
Thank you, Cindy, for your advocacy, and thank you, County Executive Crowley. Milwaukee County Operating Budget Manager Dan Laurila, I hope I'm saying that right. It was supposed to co-present with the county executive, so we want to make sure that we have an opportunity for him to share his PowerPoint as well. Dan, are you here? You are up now.
Yes, I am, and I hope you can all see the presentation now.
Yes, you are
All
up
right.
and going.
Thank you very much, Barbara, and you got my name perfectly correct, so great job. So my name is Dan Laurila. I'm the Operating Budget Manager with the Milwaukee County Budget Office. I'm here today to give a brief presentation on the 2022 requested Milwaukee County budget. First, I'd like to start with an overview of the county's fiscal condition. So the county has a long-term structural deficit. This means that the county's expenditures are growing at a faster rate than our revenues. On average, our expenditures are increasing each year by about 4%, while our revenues are only growing by 2.5%. Additionally, the county has some very strict statutory limits on our revenue. Property taxes can only increase by a small amount annually, and I really want to reemphasize what the county executive mentioned on the sales tax option. If we do get that additional sales tax, that will decrease our budget gap pretty significantly. So this deficit has caused annual budget gaps of roughly $30 to $40 million over the past decade. For 2022, our budget gap at the requested phase is $23.1 million. This is a slight increase from our original projection of $21 million. And for a little bit of good news, this is a pretty significant decrease from those previous years when we saw $30 to $40 million. So it shows some of the success the county has had for the past decade of good fiscal management. So that $23.1 million, that is the amount that the county executive must reduce expenditures by or increase revenues by, simply in order to comply with the state law and propose a balanced budget. All right, so for the impact this has on our county departments that provide all of our vital services to the community. So for several years, departments have been asked to reduce their tax levy as a strategy to help close the budget gap. So if in 1 year, a department spent $10 million, maybe the next year they would be asked to only spend $9.5 million of tax levy to close that budget gap. For 2022, given that we have a lower budget gap than in most years, the county executive asked departments to instead submit a budget using the same amount of property tax support as the previous year, instead of a reduction. So this is good news. However, it doesn't provide departments the funding for inflationary increases, for the cost of their contracts going up, for annual salary increases for employees, or for any new initiatives. These are items that all have to be self-funded in department budgets, so they need to make reductions in lower priority areas. And this is an area that ties in very closely to the county's strategic plan. One of the county's strategic goals is to become a fiscally healthy county, which means our aim is to be in a place where each year departments can make investments towards racial equity instead of having to find places to make reductions in order to close the budget gap. All right, so I mentioned there's about $23 million that the county executive must close prior to submitting his budget. Here are a couple of the options that are included that the executive will have to choose from. First, even though there is a budget gap, there are some vital investments that need to be made in the community, which may increase this gap by a certain amount. The first is some strategic plan initiatives. So the executive invited departments to submit some ideas on how they could use any potential additional funding to help further the county's mission of being the healthiest county in Wisconsin by achieving racial equity. Additionally, we're considering some investments in compensation. The requested budget includes an across-the-board 1% increase for county employees. However, we know there are some substantial compensation inequities across the county, and there's a goal to include some more salary funding to address that and help ensure that we can retain and recruit and retain the quality workforce. And then some places for savings the executive could look at, increasing the property tax levy to the state limit. The state does allow us to increase the levy based on any new construction that happens in the county, which is a slight increase, but every little bit helps. We could also use some one-time funding from the county's debt service reserve. The county is a pretty substantial reserve that from our good fiscal management in the past we have. The past couple of years, we've taken some small amounts out of it. It's not good to take a large amount out, but when we've been doing well recently, so we're able to do that. Increasing sales tax projections. In the 2021 budget, the county decreased our sales tax projection pretty sharply due to the pandemic and its impacts. And given the extra year of information we've had, it appears that economic activity is on the way back up. So we should be able to see a pretty substantial increase in the amount of sales tax we're collecting. And just to be clear, this is different than what the county executive mentioned for increasing the rate of the sales tax. That is not on the table in the county budget because it must be approved by the state, and the state declined to include that in their budget. American Rescue Plan funding. This is another one-time funding source. I have a couple slides on that we'll get to in a second. And then finally, healthcare. This is one of the county's biggest cost drivers. We'll take another look at our projected costs and then also consider any plan design changes that could drive savings, but also keeping in mind equity for employees and how this is all tied into recruitment and retention as well. We don't want to make any choices that save a lot of money on healthcare, but cause our best employees to decide they'd rather work somewhere else. All right, so we have the American Rescue Plan. The executive touched on this briefly. This is a federal law that was passed in March of this year. The allocation for Milwaukee County is a little bit over $180 million. And these are funds that are available for use for the next 4 to 6 years, and they can be allocated to some areas such as public health response, economic support, services for some communities that were hardest hit by the pandemic, premium pay for essential workers who are taking on additional risks during the pandemic, investments in infrastructure, and replacing revenue that the county lost during the pandemic. So you can see there's a lot, the county has a lot of flexibility on how best to use these funds. Those 6 areas are very broad and we can find a lot of needs there. So the Government Finance Office Association has given 3 guiding principles on how cities and counties should allocate their ARPA funding. The first principle is to note that the funds are temporary. So they should be applied to non-recurring expenditures. So while this ARPA funding, it's a pretty large dollar amount. After 4 to 6 years, it will all go away. So if we spend it all on ongoing items, then we won't have the funding for those new services that we added after a couple of years. We don't want to be in a spot where in 2026, we have all of these great services. We don't have the revenue streams to pay for them. We need to make some difficult decisions on what to remove. The next is scanning and partnering efforts. So other municipalities in the county also received ARPA funds. GFOA recommends that we work with the city of Milwaukee and the other municipalities to align our investments and see where we can make a bigger impact by pooling our resources. And the final principle is to take time and careful consideration. Since these funds can be allocated for several years, we're not required to make any decisions by the end of this year, for example, so we can take a little bit of time and decide what would have the most impact of these recovery funds. So as the executive mentioned, the county board has created an ARPA task force to review funding recommendations. There are members here representing the county executive, county board, administration, the comptroller's office, and the Office of African American Affairs. Their first meeting is this Thursday at 10 a.m. You can find the video link on the county's Legislative Information Center website if you'd like to follow along. And this task force will be making non-binding recommendations to the executive and the board. Recently, the task force noted that they're planning to rank and score potential investments and prepare a preliminary evaluation in October of 2021. All right, so for our next steps, which are upcoming, August 15th, which is actually a Sunday, so we can revise this to say Friday, August 13th. The requested budget narratives and requested summary will be posted on the county's budget website. In late August, the county executive is hosting 3 budget town halls to gather public input on the budget. At the moment, the plan is to have 2 virtual sessions and 1 in-person session, but the in-person session may be shifted to virtual depending on the public health situation. October 1st is when the county executive releases his budget. After that, in October, the county board's finance committee will review the budget and make any amendments. And then in November, the 2022 budget will be finally adopted. So that's the end of my presentation, and I'm available for any questions.
Thank you very much, Dan. I think that we just had a question from Rose Stites asking about the state hyping a windfall, and is Milwaukee County getting a share of that? I assume that that's referring to the ARPA funds, but maybe there's an additional windfall that's on the radar.
Yep, so the 2 things I think this could be about are the ARPA funds, and then also previously mentioned was the settlement from the opioid companies, where the county is getting a series of funds for that. And I think similar to the ARPA funding, it's those same 3 guiding principles will be applicable there to determine, this is one-time funding, we can't use it for ongoing things, and to take some consideration of who else has funding around us, and knowing how long we have to use it. Although the items we can use the opioid funding on are a little bit more narrow than the ARPA funding.
And the mental health block grant funding as well, there's a lot of additional funding in that bucket, and some of that should come to counties who play such a key role in delivering mental health services. So we hope Milwaukee will benefit from that windfall. All right, well, thank you so much. You've shared a lot of great information with us, and there may be some other questions that come up. I'm going to turn it over now to Mary, who will introduce our next speaker. And everyone, Dan's slides and all the other slides are on our website. I'll put the link in the chat so you have the benefit. Thanks again, Dan.
Okay. I'd like to move into the fact that transit and paratransit are very important services, and that we know that many people with mental illness and other disabilities and older adults are not drivers. And our next speaker is Dan Beam, and we'll discuss the Milwaukee County Transit System budget. Dan?
Okay, I think I'm unmuted now. All right, well, hello, everybody. Thank you for inviting me to present to you again this year. I'll jump right into the transit budget. What you mostly want to hear is what's going on with MCTS and with Transit Plus, our paratransit program. And I'm pleased to be able to tell you that there are no service reductions or fare increases or significant changes proposed for the 2022 budget. And that's primarily due to the federal funds that we received specifically for the Milwaukee County Transit System.
And I'm sorry to interrupt. Someone just noted in the chat, we aren't seeing your presentation. It's your timesheet. The wrong
Okay,
screen. I've done that before. It's easy to do. And again, if everyone can just mute, we're getting some background noise. We just want to hear Dan now. Perfect. You've got it up now.
Okay. You can still see it, Barbara?
You have up the PowerPoint now, so we're good to go. Thank you.
Okay, thank you. So back to the presentation, no service cuts, no fare increases, maintaining the system that we have. And the system that we have right now is largely shaped by MCTS Next, which is a significant route redesign that we worked on for many years. So we will talk about that just a little bit in the context of the budget as well. This first slide shows really incredibly large amounts of federal funding. And what Congress was really telling transit systems across the country is that this pandemic is going to last for a while. You're going to need a multi-year effort to respond to and recover from COVID. So we see a lot of money here in 3 large allocations. I can tell you that we have spent down the $54.9 million in CARES Act funds between last year and so far this year. And when I get into the next slide here, we'll talk about some of the other impacts and how all of this good news, bad news plays out. I mentioned MCTS Next. It was a pretty significant reshuffling of service. We've done that reshuffling within a tolerance of 1% of the service that we had on the streets the year before. So we see a slight increase. It's going to allow us to look at how this new design is serving the community and how it's working out for our passengers and the transit stakeholders. We had some good news in terms of some expense reductions. And when the fuel was extremely low in cost in the midst of the pandemic, we were able to purchase futures out into 2022 and a little bit beyond. And that helps us achieve some savings from one budget year to the next. We've also seen our institutional investments in pension and other post-employment benefits. Those funds have done quite well in this existing climate, which helps us control costs and address increases. On the negative side, or the bad luck side of things, when we initially projected ridership for 2021 this year, we really thought it would come roaring back. Nobody imagined that we would have this multi-year pandemic. So we've had to make an adjustment looking out to 2022. We are anticipating less revenue than we had budgeted for this year. And that's a $5 million revenue drop. And then many of you may know that the state budget process included a 50% cut to support for the Milwaukee County transit system in 2022. That's a $32.7 million reduction in funding for us next year. And when you take these large numbers all together, it's a significant impact on what we're trying to do in the long term. But we still have ambition for 2022. It's going to be a big year. We have a lot going on. We'll start with monitoring and reviewing the changes we made as a part of MCTS Next. I can point out that the 3rd and final phase of those changes will go into effect later this month. And we'll have a chance to see how those changes are working out. We will be working with our partners in the Amalgamated Transit Union to negotiate a new collective bargaining agreement. That'll be a big part of what we do next year. And we hope that will go smoothly and we'll get back to labor peace and focus on serving the community and not those negotiations. we are really excited that the long-term project of an east-west bus rapid transit is now under construction. We will receive the first of our 11 battery electric buses in the early part of the year, around April, and we'll begin the process of studying and shaking and testing that equipment. So any investments we see that need to be made for the other 10 buses can be done right at the factory. So we'll do pilot testing with that. And then one of the things we've been focusing on this year is 27th Street. It's a significant transit corridor. We've been studying alternative ways of serving that corridor better in the future. And by the end of this year, we anticipate to have a preferred alternative. And we want to begin the process of an environmental review that's required and prescribed by the FTA. And we want to begin the process of that relationship with the Federal Transit Administration so we can talk about design and engineering. And it takes a few years to get a BRT like we have on the East-West BRT, and we want to be earnestly working towards that on 27th Street as well. So that will be a priority for next year. Just to talk about some of the discussion points, the revenue streams that we have, passenger fares, federal and state and local sources, as described by the county executive and Dan Laurila. Those federal, state, and local funding sources can be very stagnant. And we don't have the type of funding support that's indexed to inflation. It's always exciting to hear the county executive talk about that local sales tax option, because that is something that grows as the economy grows, and that will help Milwaukee County tremendously. And we hope that some of those funds will find their way to the transit system as well as a key investment for the county. We anticipate using all those federal funds on that first slide in 2021, as well as 2022 and 2023. That does leave a rather bleak picture for 2024. We understand the state will be back at their biennial budget process, and we hope to be making a case to them in 2023 about the significant needs in 2024 and frankly, the significant impact of the cut they've given to Milwaukee County Transit and what that means for the long-term ability for us to reconcile all of the various impacts of the COVID pandemic. School will be starting up again in the fall. Universities will be back in person. We will start to see some ridership climb, and we look forward to that. We're up at about 54 to 59% of our pre-pandemic ridership level. We need that to grow because we need those passenger revenues to help us sustain the system and keep it moving forward. The other discussion point I should mention is, like many large employers, we are hiring. We're hiring for bus operators, we're hiring for mechanics, and we have been spending a lot of time doing everything we can to attract and retain employees, and we will continue to work on that. It's a challenging time. I'll just say we're not serving State Fair today. We won't be serving Summerfest. We couldn't fathom our local riders not having the bus to get them to their jobs and their medical appointments and their critical destinations while we're driving down the freeway with a bunch of people heading to a festival. So we had to make the hard decision to really focus on our core ridership areas and our core system, and even with our workforce shortages, to continue to provide the best service we can in that area. Let's see. Moving along, we talk often in Milwaukee County about the vision of achieving racial equity and becoming the healthiest county in Wisconsin. Transit is a critical part of what we're trying to do. It's a significant investment of Milwaukee County in supporting the economic growth and competitiveness. Investments in transit help achieve that equity. And it also provides great service for everybody and accessibility and transportation. But it is an important part of what we're trying to do for advancing and achieving racial equity. Really, the sustainability of the system in the long run will depend upon getting some funding that's more indexed to inflation, so we can keep not just providing the baseline level of service, but to continue to grow and expand. So we're excited about the new year. We're focused on the new year. This final slide just gives a lot of the various websites where you can get information about the transit system, travel training, the paratransit program, and really our key and big projects, MCTS Next, the East-West BRT, and the North-South Transit Enhancement Study. And I can take any questions if there's still time. I'm sorry if I've gone long.
Thank you very much, Dan. You're fine on time. People are welcome to ask questions in the chat, and I'll kick it off with a couple of them. One question is, people with disabilities and older adults are a group that has additional vulnerability to COVID-19, and many individuals rely on paratransit services. Can you tell us a little bit about what you're seeing with paratransit? What has the ridership been? Is it remaining steady? Has it gone down? And what things are being done to ensure that the higher risk population is safe and protected during the pandemic?
Yeah, we work very closely with our two primary paratransit subcontractors. That's First Transit and Transit Express. We have emphasized with them that they can have fewer people on the vehicle if they have the drivers and they have the vehicles to space people out. We have been working with them on all of their cleaning and sanitizing procedures. We are all working under the federal mask mandate, and thankfully so. It helps protect our employees, and it certainly helps protect all of the passengers. So we're glad that that is in place as well. The ridership is starting to come back a little bit faster on paratransit than on the rest of the system. They're up to about 60% of ridership. We've been working with those vendors to try to provide for any of their employees that have had less hours. We're doing our part to make sure that they retain their employment and are ready to provide transportation for paratransit individuals as the demand for those destinations come back. So we think they've been doing a very good job of keeping everybody safe, and will continue to do so.
Thank you very much. That's good to hear. The other question is more of a policy question. It was really disappointing to see the state budget take such a step backwards and reduce transit funding in Milwaukee County and in Madison instead of increasing it. And that was something that was an advocacy priority for the mental health task force. And we tried to advocate and hope there would be an opportunity to veto that, that reduction, but that evidently wasn't possible. I wondered what your assessment is for the next biennial budget. Is that reduction something that will then be in the base budget? So we're going to have to fight to get that money back in there for the next budget cycle?
Well, that's an excellent question. And the way the state budget was written, as we understand it, is that was a one-time 2022 decrease, and the funds are restored in 2023, which are a part of this existing budget. So we lag the state budget process a little bit. The governor's office has been wonderful to work with. They've been asking for and seeking those increases. in transit funding, and they just didn't get very far with the current legislature. We need to do our job of telling the story to the legislature about all of these federal dollars and how we're using it. And we are being careful and considerate about balancing the capital needs for the system and the operating expenses associated with the pandemic, and wanting to preserve those funds, as I think we heard Dan Laurila and the county executive both speak of. You know, we really do have to be careful about how we use these funds so they can continue to benefit us for the duration of this pandemic and move you know, our whole community forward. But we are going to need help from the state. The state is our largest funding source. They'll be back working on their next biennial budget. We are going to absolutely need that help in 2024, or we will be facing a very dire fiscal gap that I don't think Milwaukee County has the means of working through for transit because of all of the constraints that are on them.
Yeah. Well, thanks for your frontline perspective there, and let us know how we can be helpful moving forward, because so many people with disabilities, with mental health needs, older adults are non-drivers. So that transit system is essential, and Milwaukee County is the economic engine for the state. People who don't have transportation can't get to jobs. So investing in transit is smart. Cindy has a question. Go for it, Cindy.
So I don't, you know, you hear rumors and you're on the van with different people, and they, you know, somebody said that the Transit Express and what do they call the other one? The big van, I forgot what they call their van.
First Transit?
Right, that First Transit was going to try to buy out Transit Express and just have one, you know, one van company. And I'm not saying that this is true or not, because sorry, this thing got in your way, but you can hear me. Is that I don't know what's true about it or not, but for so my orders that you know about People First, if you've been set on. So our People First, our members, majority of them don't drive. We might have 6 or 7 people in Milwaukee with disabilities that drive, and statewide, not very many either. And you know, our bus company, I think, is very good. Our transit bus company, I've been just viewing the routes and how they're operating. You got a purple line that goes all the way to IKEA. Somebody wants to just take a bus ride. I think it's good, because sometimes when you have mental health issues and you just want to get on a bus and take a ride. But of course, because of COVID-19, you can't. But this helps people that don't drive to take a bus wherever they want to shopping. And you guys, I've been studying all the bus routes. I just took the thing that they put out, the purple line and where it goes, and I've been investigating. I put a little map on for myself just to see where there's more options for people now to get to jobs, get to grocery stores, because you can't depend on your parents all the time or your guardians to take you to the grocery store. And we want to, and I want to say, we want to be independent. I want to just, hop on the 68 right here by my house and go to the grocery store, which is right up the street, instead of taking the train. I do have to take the transit van for health reasons, and I only take it like today. I would have to take it because extreme heat and all this. But for me to I just walk straight up, get to 68. I'm at the grocery store, at Trader Joe's or whatever. And then there's a lot of connection buses, and I'm very happy with that. So I'm independent. You don't have to wait for somebody to give you a ride or wait for the transit van to pick you up. And I want to say there's a lot of improvement with the Transit Express since you guys changed some of the, they don't go all far as they used to go. So you see a lot more on time stuff. And so I just wanted to say that I don't want to complain because I appreciate I can take the bus and the van. I need both. And I know sometimes people say, oh, you don't look like you need to take the van. Well, what I do, my doctor states that in a nice way. But
Cindy, thanks a lot for the positive feedback.
I
That's
mean,
really
so
good
I
to
just
hear.
want to say that I think you're going to hear a lot from advocates that they like what you are doing, connecting buses. And believe it or not, my cousin is now a supervisor with you. Carmen Delaney is supervisor out of the Fond du Lac. She's my cousin. And she always trying to get me on the TPAC thing. I'm just a little too busy at the moment, but someday I will be able to do that. But I just want to say to you, instead of complaining about things, let's see about making it work for people with mental health and people like me and the elderly. And I think people I see people over 80 on the bus, they should not be on the bus. They should try to take the van. 80 years old taking a bus is not what I said. But thank you for listening to me, and I want to thank you. I'm not going to yell at you or complain. I'm thankful for what you guys are trying to do to get people where they need to be.
And I appreciate those comments, and we do work hard to provide good service out there. And we have some good partners in the community, whether it's the vendors and certainly all of the bus drivers, whether they're
You got
with the
some
Milwaukee
great
County
bus
Transit
drivers.
System or the contractors.
You have some wonderful bus drivers. Don't get off their bus if somebody can't get on off their bus, helping the person get on the bus. So they should get a gold star. Thank you.
Well, thank you so much,
improvement.
Cindy. We're going to have to move on to our next
All right,
speaker,
thank
but I really appreciate your positive feedback. And I know Dan does.
I know,
Cindy
thank
Freeman,
you.
I think you need to mute. We're getting a little feedback.
Thank you, Dan.
All right. We're ready to move on now to our next speaker. The Milwaukee County Department of Health and Human Services plays such an important role in providing services for our county. They're really the safety net. And we're really lucky to have Shakita LeGrant-McLean. She's been a tireless advocate working to increase access, tearing down barriers, and advancing a culture of no wrong door. So welcome to Director McLean and her team, and we're looking forward to hearing from you. And my colleague Jeannie Parker is going to be sharing the PowerPoint. So if you want to get that up, Jeannie, that would be great.
Thank you so much, Barbara. It's so great to be here. Great to see many of your faces. As you stated, I do have Matt Fortman, our CFO, and Claire O'Brien, our Policy and Budget Director, here with me to help present. You can go to the next slide. We'll jump right into it, make sure we have time for questions. So here, this just provides an overview of DHHS, and we consist of the Behavioral Health Division, Disability Services, our Housing, Children and Youth Family Services, and our Aging and Veteran Services. And the thing that I just want to highlight here is the vision, because the vision is together creating healthy communities. When we say together, that is just not DHHS, that is us as a county, that is you as the Mental Health Task Force, that is our stakeholders, that is our community, that is each one of you at the table to help us to do that. You can go to the next slide. And so here, this slide is really about the 2022 budget and our strategic alignment. So we will be releasing our strategic plan in a couple of months, and we will share that with you. And so you will see the bubbles around that shows all of those things for our strategic plan. But the DHHS budget, it does overlap with the themes of our future state. And it features several overarching themes as the upstream investment in prevention, transforming systems, cultivating staff and culture, and of course, building toward that no wrong door. You can go to the next slide, please. And so here, this slide here, these are all of the great initiatives that we're working on. In the 2022 budget, we are challenging ourselves to improve health outcomes of the people that we serve. It also reaffirms our commitment to the countywide mission of achieving racial equity so that we can become the healthiest county in Wisconsin. And so as we look at our prevention and transforming systems, some of those initiatives that you'll see here is that we are building a new mental health emergency center right near COGS. And we are hoping that we can have that up and running by May of 2022. If you go towards that area of COGS, you will see the construction and the fence going up, which is really exciting because we know that has been a work in progress over the last 10 years. And so the new mental health emergency center will provide services right in the heart of Milwaukee County. At the Behavioral Health Division on Watertown Plank Road, we know that 90% of the people we serve are from city of Milwaukee, and 70% are in the proximity of that zip code, 8 being on the north side and 2 being on the south side. This, along with, we have a planned renovation of COGS building, and we will have a slide later on in this deck, will create a human services campus. So it's gonna provide improved access to services. So no matter where someone enters, as we talk about no wrong door, we are able to wrap those services around them and get them connected to services, programs, or resources. The next one is our housing navigation with the, nope, not the next slide, I'm sorry, thank you. We're gonna have a, we will have someone at the House of Corrections dedicated to serving individuals who are transitioning from the House of Correction into the community, ensuring that they have safe and affordable housing. And then we have our new Children, Youth, and Family Services Program Manager who will focus on prevention and connecting youth to community-based services as we talk about investing upstream to keep our children from the deeper end of the system. The other initiative on here is as we prioritize our youth justice reform measures. So we were able to put a considerable amount of investment into our Credible Messenger program with the surplus that we have from last year. So this program has taken off. We are connecting our youth to people with lived experiences, building relationships, and providing mentorship. We have also this year invested in a youth employment with our first ever youth employment initiative across the county and DHHS. So we are serving young people ages 14 to 24. And so the goal of this youth employment initiative is to connect our youth across DHHS and Milwaukee County. So if children are in our programs, programs under our disability services, under our wraparound, under our Division of Youth and Family Services, we are able to get them connected. We are able to invest in them and help them to learn new skills. So very excited about that program, and we'll continue to invest in that. Affordable housing and access and sustainability for older adults of color. So there has been a large investment in housing in this budget. We know that housing is health, so we will continue to invest in the older adult population, our children, our youth, and people with different abilities. So this is one of our priorities. We're also looking at expanding our behavioral health crisis mobile. So there has been a call for non-law enforcement solutions to mental health crisis situations. We know that there will be times where it will be needed, but there are a lot of times when it is not needed. So our behavioral health mobile crisis is a resource that we have where clinicians respond to individuals with the mental health crisis. By expanding our mobile crisis, we are demonstrating that we hear what people are asking us to do, and we are responding. So I am happy to report that we are adding 15 new mobile crisis staff for the budget. So very excited about that. As we look at cultivating, that's the second row, as you see there, cultivating our staff and our culture. So we're gonna launch our culturally, linguistically, and appropriate services, as we call them, class standards. These standards are developed and will be implemented across Department of Health and Human Services. These will not be a separate policy. Many times that we implement something and we have this separate binder or handbook that we're looking at, but instead we want this to be embedded in all the work that we do. So this is a further investment in health equity and also quality improvement. Our class standards will help eliminate healthcare disparities because services will be tailored to meet the needs of individuals, their culture, their language preference. So this is going to be critical as we look, as we implement that across the department. There's also an ongoing commitment to our staff training to help them to develop a better understanding of the people that we serve. So a lot of training that has happened, and some examples of that will be, we've had some LGBTQ training. Here, Wisconsin came in and did some training for staff, Vision Forward. We've had some trauma-informed care training. We received a grant with Birth to 3, also healing focus. So a lot of our providers not only receive the trauma-informed to identify the trauma, but also how do we heal after that? So very proud of that work. There has also been employee investment as we address our human service worker pay equity gaps. So for DHHS, human service workers is the largest group across of staff that we have across DHHS. So many of these staff, they are in our disability services division, our youth and family services division, and our aging division. And so what we did, we worked with our compensation and we looked at each individual human service worker. We took into consideration their years of service. We took into consideration their performance evaluation. And when we took that look, we didn't set a goal of how many we were going to look at for pay equity, but we're very proud that as it turned out, there were 50% of the human service workers that we've seen were in that lower pay range that we have invested to make sure that we can increase pay for those human service workers in the budget. We know that there are other pay equity gaps across the Department of Health and Human Services, but we will continue to be committed to address those disparities, and we will continue to, make sure that we are not just for our staff, but our contracted staff as well. There's also continued focus on building a culture of transparency and employee engagement. So we want our staff to be engaged. We want them to be a part of the decisions that we make. We want them to be informed. So our goal is to make sure that our DHHS staff, they know about the initiatives, they can speak about our work, they know what the vision is. They are working together to move the needle on health and racial equity. And so to promote that transparency, we host town hall meetings, we have one-on-one opportunities just to make sure that our staff are able to be heard. And the last role that you see here is really No Wrong Door. As we look at No Wrong Door, the integration of the Aging and Disability Resource Center. In the budget last year, we talked about integrating the aging and veteran services, all of us under the Department of Health and Human Services. And we knew that in 2022, we were going to integrate the Aging Resource Center and the Disability Resource Center to become one Aging and Disability Resource Center as of 2022. We will be submitting our application to the State Department of Health Services as of September that is due to them. We also have we will have a new Children, Youth, and Family Services, which will include our disabilities, the children's service that's under disability services. So because we now have an area for adult services, we feel like it's a natural progression. I know I've talked to you all about our children's integration and having that integrated line, but this is a natural progression as we move children's services from disabilities to this new Children, Youth, and Family Services, which was previously Youth and Family Services. So it will include our birth to 3, it will include the Children's Long-Term Support Waiver, and it would include the Children's Community Options Program. The unique thing about this is that this new service area will be working really closely with our wraparound program under the Behavioral Health Division. So the wraparound intake and screeners who are doing those assessments will not just be doing wraparound screenings and assessments, but they also would be doing assessments for programs for the children's services under disability services. So again, if we talk about breaking down silos, and as families come through that door, we're able to make it easier for them to access services and programs, and also to get them connected to resources in the community. So that is something that we're looking at. You can go to the next slide. I wanted to share this. I know we don't have much time, but just a high level overview about the new Adult Services Division. So this, as we began to report out and we got input from our boards, we reported out to the Commission on Aging, our Combined Community Services Board, our Aging and Disability Resource Center Board, and we showed 3 options for the org chart on how do we look at the integration of the Aging Resource Center and the Disability Resource Center. And so the option that you see here is the option that we all agreed would be the best way of how do we, again, move the work forward, create easier access for both older adults and people with different abilities. And we did not include this in the requested budget, but are looking at including this in our recommended budget. The reason that we held off on the requested budget because there are upcoming community input sessions. So we got the input from our boards, and we also wanted to make sure that we were able to get input from our community to share the org chart, to get their questions, to get their concerns. And if everyone is in agreement, feels like this, again, no services are going to be changed. They will continue to be able to get the same services. It's just how do we make it easier? How do we break down silos? So we have an area agency on aging, we have our adult protective services, and we have our Aging and Disability Resource Center. If you all will remember back when Department of Aging was there, this is pretty much the same org chart. So what you have is your division, and then you would have your what was in Department on Aging was the Area Agency on Aging, which you see here. They had the Elder Abuse Unit, which is our Adult Protective Services, that is in the middle. And then they had the Aging Resource Center, which we would have Aging and Disability Resource Center. So it's the same structure here. Those input sessions will take place later this month. I believe it's scheduled for August 26th and 27th. I'm sorry. I will send that information to Barbara so that she can share that with you all. I'll go ahead, if you can go to the next slide, have Claire and Matt, they will cover some of the budget numbers, the AAA, and some information about the Cox renovation.
Thank you, Shakita, and good afternoon, everybody. This pie chart is showing the allocation of our revenue sources as part of the 2022 requested budget. I think the important takeaway from the pie chart is that DHHS is unique. The majority of our funding is derived from state and federal sources, so only 21% comes from the tax levy. So we are very fortunate for our outside revenue. Our goal is to maximize our revenue streams, and we've really been focusing our efforts on creating sustainable funding sources. Another point I'd like to make is that a significant amount of ARPA funding and mental health block grant funding is anticipated for our department. Although it's not part of the 2022 budget yet, we're still determining the amount of new funding. Next slide, please. This budget summary table reflects all areas of our department, including the new Children, Youth, and Family Services, our Housing Division, Behavioral Health Division, Disability Services Division, Veterans, Aging, and Housing. As part of the 2022 budget request, total expenditures reflect $397 million. There's $312 million in total revenues and nearly $85 million in tax levy. And compared to 2021, we have budgeted about $20 million more in expense and revenue with a slight reduction in tax levy. I now just want to focus our attention on some of the budget highlights to the right. These are the major initiatives that are really driving the budget, and Shakita highlighted a number of these in the earlier slides. Matt and I will just go through these briefly. So for our disability services, the Children's Long-Term Support Program is expanded. That total impact is 4.8 million, but the number of children coming into that program has grown by 20% compared to 2020. And Milwaukee County is actually leading the state in CLTS enrollment. Our Housing Choice Voucher program is expanded with 63 new emergency vouchers. And that total amount, fiscal impact is 1.4 million. Matt, would you like to take the other initiatives in the service expansion section?
Sure. We also have $11 million in increases in the Comprehensive Community Service Program. That's both for youth and adults. We're continuing to expand services and increase enrollment even throughout the pandemic. We have $500,000 for supported employment program. And we're able to do this because we freed up some grant funding through the new Medicaid expansion to substance use disorder residential programming. So thank you all for the advocacy you did on that front. We're able to expand our services to a new area there because of that change. And prevention, we have a housing navigator position in collaboration with the House of Corrections to support reentry for discharges from the House of Corrections. Long been struggles with that, so we're really excited to move forward on that position. $2.5 million in new and continued youth justice investment. As we reduce our population at Lincoln Hills and Copper Lake, that frees up youth aids dollars that we can reinvest in the community on more front-facing community services like credible messenger programs and things like that, more aimed at prevention and diversion. We have, as Shakita mentioned earlier, increased support for crisis mobile team and crisis services in general. Again, very excited to expand those non-police crisis mental health service interventions. We have support for the mental health emergency center. Now with the psychiatric emergency room closing as the mental health complex closes, we're very excited to be moving forward on the new mental health emergency center, which is being built right now in the parking lot at COGS. If you want to drive by over there and see that it's really happening. And of course, $2.7 million in funding for psychiatric inpatient services at the new Granite Hills Hospital in West Dallas. In terms of staff and provider support, we've had wages stagnate in many categories for many years now at Milwaukee County. We're very excited to move forward on a pay equity increase for human service workers. There's been a lot of turnover in these positions lately, and we feel that this will provide more continuity of staffing and show our appreciation for this really highly valued classification in our organization. Additionally, we have $1.4 million for provider rate increases for our community support program providers, and that's going to be divided between a new base rate increase for providers as well as a performance incentive component for the providers of those programs. And we see that as an even more important service in our network, especially as we transition to Granite Hills and other hospitalizations. That's really important for keeping people happy and healthy and in the community. I'd also like to mention that we have funding for additional peer supports. We have funding for additional marketing and outreach services. We have a lot of exciting things going on in this budget that we just don't have time to talk about right now, but we're really, really happy to be expanding services, especially when the county's budget is so tight. Next slide, please. I'd also like to talk about the Area Agency on Aging budget and just highlight a few more things. Again, we're really excited about the use of ARPA funds here. There's actually a specific allocation of ARPA funds just for Older American Act funding. So that will be something that we're going to be making decisions on in the near future here. The budget also funds a new transportation coordinator position that's going to coordinate transportation services for older adults and individuals with disabilities. Kind of like what was discussed earlier. So very excited about that. Actually, I think we're in the process of hiring that position, or it might be hired already, but we're very excited to fund that in 2022 as well. Continued support for our elder benefits specialist position. And of course, very excited about the new senior meal dine out program that offers senior meal services at area and culturally appropriate restaurants. Next slide, please. This is the COG Center relocation. And I know there was a question about this for County Executive Crowley earlier. We did a very lengthy real estate search, saw a lot of really exciting options, but in the end decided that COGS was really the right place for us and the place that we want to be. It's the right location. It's centrally located. Everyone knows where it is. It's going to be adjacent the new mental health emergency center. We see value in that. We do recognize that there are substantial improvements that need to be made, especially on the first floor with regards to customer service, accessibility, et cetera. So we're working with our facilities management team and a team of architects on re-envisioning what that first floor looks like and requesting substantial capital investment on making that a warmer, more welcoming, more modern area that people will be excited about visiting, and also taking into consideration parking options, especially parking for visitors, making that more simpler, more accessible, et cetera. So I know Barbara and others have been very vocal about the changes they'd like to see in COGS, and we are listening, and we're excited to move forward on that and share more details as we finalize the FIT plan. Next slide, please.
So I know we don't have much time, so I just want to quickly just highlight, as we combine some service delivery, it has allowed us to increase the availability of services for older adults, people with disabilities, and our veterans. So this chart here, I won't go through each thing, but what it does is demonstrate how we have improved collaboration and how it has had a positive impact on the people that we serve. So it shows the different areas and how we worked across to have some of those initiatives. We created some guiding principles. We included a lot of our governing boards. We have shared that with a lot of our stakeholders. So I think there's a lot of great things that have happened. So I'll go ahead and go to the next slide for this one just to save some time. So as we talk about our strategy and action, Milwaukee County, under the leadership of County Executive Crowley, there's 3 strategic focus areas here. So create intentional inclusion, bridging the gap, and investing in equity. And so DHHS initiatives support intentional inclusion. So as we look at employee training, mentoring, policies to address complaints of racism and bias informed by our employee survey results, looking at the pay equity for our human service workers. If we look at bridging the gaps, how we're contracting practice improvements, we did a racial equity in contracting, which was done by external evaluator. Looking at how do we fund basic unmet needs such as hygiene products that participants need. So it is our job to see what those underlying needs are and how do we meet the needs of the people we serve. So have that holistic approach. If we think about investing in equity, some of the initiatives that we support that is really getting the public feedback. So we had some public listening sessions and really look at how do we reinforce the strategy to invest upstream, locating services that are near where people are living, funding preserved for our peer specialists, expanding interpreter services, looking at our youth and family credible messengers to make sure that we have them in a community for our youth, the children's long-term support and the comprehensive community service expansion, expanding the Dine Out program. Our goal is to increase meals by $7,000. Looking at new dining sites. So all of these things that we're looking at, these are just some of the things that we are doing to address the 3 strategic focus areas of Milwaukee County and how we're working in advance to the county's vision. You can go to the next slide. And so if we think about realizing the vision, having bold initiatives, we really are moving the needle on on racial equity and becoming the healthiest county. So we look at Aging and Disability Resource Center and our children's integration. It emphasizes being person-centered. The focus is on the person. If we think about our COGS renovation and co-location of our staff, that fosters collaboration and innovation. And some people may not think that COGS is the best location, but if we can update COGS, if we can get the input, if we can make it more accessible, if we can make it a warm and friendly place, which our priority is to do some renovations on first floor, bring our Aging and Disability Resource Center to the first floor, have a separate entrance for DHHS. There's a lot of things that we could do to make it a better place to serve. But again, being right in the center of where we can do that work, that is going to be innovative and it's going to foster that collaboration. The expansion of mobile crisis, combining our children and adult teams so that we can provide services across this lifespan, that we can have lower wait times, that we can improve service delivery. Our mental health emergency center, what a remarkable thing that we have done to have a public and private partnership to have a high quality and easy accessible mental health services, again, right in the heart of the city. And then we have served over 5,000 households and helped them to avoid eviction since March. Remember, housing is health. And then our credible messengers for our youth. This is something that we will continue to do, invest in our youth because they are our future. We cannot give up on them. And sometimes we do have to believe a little bit more in them than they believe in themselves to push them to go to that next level. And so again, if we think about realizing the vision, having the bold initiatives and those type of things, it is together that we are doing that. And it's going to take all of us to come to the table. And so if you have questions, if you have concerns, you can go to the next slide. We are here to answer those for you. So I'm sorry I went over time, Barbara, apologize for that.
Shakita, thank you so much. I have to say, it really fills me with hope to hear your enthusiasm and vision. So, thank you. I know that we're short on time, but we did have a question from a great advocate, Denise Johnson, and then she put it in the chat. So I'll just read it to you if you didn't spot it. She was interested in the training related to class, and she has a lot of expertise in working with people who are deaf, hard of hearing, and she sees that often the people who are providing that are not people who themselves are deaf or hard of hearing. So she wondered what your plans are, and is concerned about having people who are not part of that culture being seen as the experts.
We have been bringing in a lot of experts, but Denise, is it okay that I reach out to you to make sure you are a part of that group? Is that okay? And I can put my email in here too, but if you can share your information, I'll definitely reach out to get your input and have you at the table.
Sure, this is Denise speaking. Yeah, that would be fantastic.
Perfect. Thank you so much.
Great.
Did you put the email in the chat, or did you want me to put mine in, or?
I will put mine in now.
All right, well, it's great to see connections being made, and we're eager to make other connections. So we'll look forward to the information about the listening session. And again, just a reminder to everyone that the PowerPoints are all on the Mental Health Task Force website and available. And Shakita has an open door policy, so she's available as a great resource for you. So thank you very much. I'm sorry we don't have more time, but you shared a lot of really positive information.
Barbara, can you hear me? This is Dr. McManus.
Oh, yep.
For some reason, I'm having trouble with the chat. I've been trying to get stuff in there. And
Sorry.
Yeah, I don't know what's wrong. It's probably me, but I'm having trouble with it. But I just wanted to ask Shakita before she left, because I've been raising issues around equity. And I hear, it seems like it's a new buzzword, but I haven't heard how that's supposed to work to actually get equity. A question on whether the people really understand when they say that, what that means. Most people think equal and equity is the same thing, and it's not, and so I was wondering, what are you guys doing in terms of making sure that the community is trained, at least on what your view of equity is? But I would like to maybe have a conversation with you at some point, if you don't mind.
Absolutely. Please, my email is in the chat. We can schedule on one time. We are working really closely with the Office of African American Affairs. A lot of the training that we have, we're also offering it to our boards because we need them to be informed and understand the difference between equity and equality, right? Difference. And also, you're right. We need to also make sure that the community, they understand the direction that we're moving in and what that truly means. So please, can you reach out and we can schedule one time? Okay.
Thanks.
All right. Thank you so much, Dr. McManus. You're such a great resource, and we've learned so much from you. So glad you'll be making that connection, and we'll turn it over to Christine now.
Hey, thank you to Department of Health and Human Services. Without further ado, I'm pleased to announce our next speaker, Chantel Jewell. She is the Superintendent of the House of Corrections. Welcome, Superintendent Jewell.
Good afternoon, everyone. Mike, can you put our slides up? You can go to the next slide. So once again, my name is Chantel Jewell. I am the Superintendent of the House of Correction, and I have co-presenting with me our Public Safety Fiscal Administrator, Michael Bickerstaff. The mission and vision of the House of Correction is we're very clear that our goal is to provide a safe and secure environment and provide resources to individuals that so that they leave the House of Corrections in a better place. And it's through collaboration and partnership with our community partners that we seek to address drivers of criminal behavior, enhancing quality of life for the individuals that are in our care post-release, and ultimately create a safer community. Next slide, Mike. So in terms of our racial equity strategies, first of all, we look at who we're hiring. And so we're seeking to hire a diverse team. We're doing some targeted recruitment. We want diversity at each level of management. And so we are changing our messaging to attract the type of individuals that we want to have at the House of Correction. We're really, corrections oriented, rehabilitation oriented, versus the law enforcement orientation that a lot of individuals are attracted to the House of Correction. Our makeup currently is we're about half and half in terms of male, female, and we do have a diverse security workforce at this time. our budget proposal, we were fortunate to not have to cut any programming. We are intentionally seeking out those partnerships to meet the needs of those individuals here in the community. We realize that we're only going to have the individuals for a short period of time, and the real work is going to happen in the community. So we're being intentional about that, and we're being thoughtful about the programs that we are bringing to the HOC. And then we were fortunate to be able to extend our DRC program to the House of Correction. I mean, not the House of Correction, Department of Correction, and working with their individuals who have alternatives to revocation. So that's keeping less people out of incarceration, more people in the community getting those services, those much needed services in the community. And next I'll let Mike talk about the numbers, our budget, to give a budget overview.
Yes, thank you. As you can see, our expenditure request is increasing $660,000. That's due primarily to our medical contract. Our revenues are down about $75,000. That's due to loss of funding for the alternative care facility. Overall, our tax levy is increasing by $735,000 for a total of $44,587,000 to operate the House of Correction. And obviously, as I just said, the increases are due to the medical contract and slight decreases due to federal funding.
Okay. And so some of our budget proposals or what we've added to our 2022 budget is DHH just mentioned that we created a housing navigator position to be located within the House of Correction. Anytime I speak to individuals who have been impacted by the justice system, housing always comes up. So we wanted to make sure that we could adequately assess and provide resources to individuals at the House of Correction prior to release. You know, also I have a goal of creating reentry plans for any individual that is here longer than 90 days. And so we were able to add a social worker position into our budget to help with that assessment and help create those plans. We were able to continue with our day reporting center and services provided by the Benedict Center. We were also able to create a resident support team and a resident and a dormitory that houses individuals who have certain mental health conditions that being a general population is a challenge for them. So we created a specialized dormitory where there's more presence from mental health professionals. The staffing patterns are different. We have more staff to offer that support, and 25 staff trained in CIT to work in that dormitory. And then we have a continuation of our medicated assisted treatment program for individuals who are able to receive Suboxone or Vivitrol while here at the facility, and eventually they like to add methadone onto that. So those are some of the things that we're doing in the 2022 budget. And that's I think that concludes our presentation.
Well, it's me again. This is Dr. McManus. I want to just say hello to Chantel for sure, but you know, I haven't had a chance to get to you because I wanted to have you set into your role before you have to deal with me. But I would like us to come back. You know, we were doing educational services at the House of Corrections. We were also doing it in the jail. And so we're trying to figure out once COVID is at least at some point, because it really helps in terms of with both groups. We serve primarily men at the House of Corrections, serve more pregnant women at the jail. But our job really helps them understand trauma, stress, not only what they do, but I mean, for themselves being in there. And we really got really good responses, even for the staff. By the time all this happened, we actually had 4 or 5 staff people in there listening to what we were talking about too. So at some point, can I give you a call and we can have a meeting or have a conversation around? I would like to bring, I think they really do help. And right now it's not a budget issue for you because we've been doing this as volunteer for 3 years now. So it wouldn't be a budget item for you, but I think it'd be very helpful.
Dr. McManus, you know my door is always open to you. Absolutely. Give me a call. We can set something up. We thought we were well on our way to beginning to get back into our programming swing, and then the Delta variant came up. And so
Lambda's come up, guys. So that's the next one that's there.
The what?
The Lambda, that's the new one they announced 2 days ago. That's, yep, that first came, yeah, there's two, because we're doing training, we're doing educational sessions out in the community. So every day I'm keeping track of that. Yeah, but now it's a new Lambda variant, and it's came out of India, but there are some, it is in the United States yet. They haven't, which states they're in, but that's the next one that's coming, that's there. So it's really, people just gotta somehow, and that's part of depression and everything I'm talking about, the fact that folks are thinking, oh boy, we're finally coming out of this. Of course, I was been saying it since March, no, you're not, this is not over, not over, and folks didn't want to hear that. But that's important, and when people, not only people who are incarcerated, but their staff, your staff, that's important to really kind of know that this is going to be around a while. And then what do you need to do to try to make things as much as you can work with it. So I will give you a call. We'll talk.
Okay, thank you.
Thank you very much, Superintendent Jewell. I know we're a little bit tight on time, so not as much time as we'd like for dialogue, but I just wanted to mention that although there aren't more elections this year, next year, 2022 is a big year for voting, and Disability Rights Wisconsin and League of Women Voters and others would welcome the chance to work with you to provide more support for voting as well as voter registration for individuals at the House of Corrections. So looking forward to having a chance to present that. Thank you.
Okay, our next speaker is Theodore Chisholm, who will share the budget request for the Milwaukee County Sheriff. Welcome, Chief of Staff Chisholm.
Thank you, Ms. Neubauer, Ms. Beckert, and Dr. Apple for hosting today's budget forum. And I want to thank as well everybody who's attending today on behalf of Sheriff Lucas for your participation and for your advocacy in service of a strong and safe Milwaukee County. I will activate my slideshow here. I also want to note that joining me today is Fiscal Administrator Pat Caravetta, who works, she and I work very closely together on the drafting and development of our annual budget, and she will be speaking to several of the points as we continue in our presentation. To provide an overview of what we do at the Milwaukee County Sheriff's Office and who we are, I'll note first that our overall scope of services is to provide detention, patrol, investigative, and support services that serve and protect the people of Milwaukee County. And our operations are most closely associated with some specific operating areas. And you'll see them on your screen here, but to summarize them, because I know we're a little bit short on time, we provide security and operational services at the Milwaukee County Jail, which we're responsible for administering. We also provide security services to our courts and our airport. We provide proactive police services, so uniformed patrols, of our parks and our expressways in Milwaukee County. We have a number of really essential support services to include not only criminal investigations and then some specialty units like explosive ordnance disposal and major incident response. But we also operate, and this is a very new and exciting initiative that we're rolling out this summer, the Crisis Assessment and Response Team, which is a really exciting initiative that we're rolling out in partnership with the Department of Health and Human Services and the Behavioral Health Division to maximize our agency's responsiveness to individuals who are experiencing psychiatric crisis and ensuring that the response that our agency provides is humane and it results in non-institutional outcomes. I know the CARD approach is one that's been really successful at the West Dallas Police Department and at the Milwaukee Police Department. And it's something that we're really, really eager to roll out here at the Sheriff's Office. We recently received funding to sustain its rollout this summer, and then moving into 2022 with a fully staffed CART unit of 3 deputy sheriffs supervised by a lieutenant and reporting to Sheriff's Administration. Again, it's a commitment of Sheriff Lucas and of our entire agency to engage in a manner that de-escalates tense encounters, that affirms the human dignity of everyone with whom our agency interacts, and to ensure that individuals who are experiencing psychiatric crisis and associated challenges encounter our agency in a way that, that affirms their dignity and their rights. So that's a unit that I know is of great interest to a lot of advocates throughout our community, and I wanted to make sure I gave a quick overview of our progress there. Also want to thank BHD for their engagement in this process too. Additionally, accountability and administration are key components of our agency. We are very much invested in legal compliance and regulatory compliance, ensuring that all of our operations align with our statutory mandates at the state level, the expectations of our county board laid out in the ordinances and resolutions that the board has adopted, and then also our community's expectations, making sure that our agency's operations, again, are accountable, they're respectful of our community, and they're responsive to our community's public safety needs, addressing violent crime and devoting resources to ensuring safety and justice for all in Milwaukee County. Our values accordingly are honor, integrity, and a firm and unyielding commitment to affirming the public's trust. Essentially, just to summarize, these are 3 values that Sheriff Lucas has instated throughout our agency, and there's something that we strive continuously to live up to. We've achieved significant progress over the past 2.5 years in ensuring that each of these values is lived out through our agency's operations, especially within our detention services. I know that for many years, the operation of the Milwaukee County Jail resulted in a great deal of very rightful concern in our community due to the conditions of confinement and concerns about the well-being of persons detained there. Something that we've achieved within the past year for the first time in the history of the Milwaukee County Jail in complete alignment with these 3 values is the first ever accreditation of the jail's health services by the National Commission on Correctional Healthcare. That accreditation marked the culmination of a years-long process of collaboration between the Sheriff's Office, our partners in county government, including the Department of Health and Human Services, the House of Correction, certainly the County Executive's Office and the Department of Administrative Services, and the Procurement Division to advance the cause of high-quality, responsive healthcare within the jail facility. Contemporaneously with those improvements, we've worked very, very intensively to ensure that the jail is a safe and humane environment for everyone who's detained there. Likewise, working with partners throughout our community, we've worked to really build out our agency's community engagement functions in a manner that not only serves the purpose of visibility, but serves the purpose of genuine law enforcement reform, tying our community engagement efforts to youth engagement in our county parks, which we patrol, to working on significant policy upgrades in consultation with community partners. Earlier this year, we presented at the City of Milwaukee's Community Collaborative Commission to discuss significant upgrades to agency policies in the areas of use of force and the internal investigations that accompany such incidents. Again, honor, integrity, and affirming the public's trust really are the driving factors in everything we do at the Sheriff's Office. With that, I'll defer to Administrator Caravetta to discuss our agency's 2022 requested budget, which I'll note is an ambitious ask, but an ask that will account for the financial cost of each of the initiatives that we're undertaking to enhance accountability, address our community's public safety challenges, and move our agency forward to meet all of our expectations.
Okay.
Good afternoon, everyone. Thank you for inviting me to this presentation to give an overview of our requested budget for 2022. On the slide before you, you'll see that we have asked for an increase in our expenditure authority, a 9% increase, and that our tax levy authority, we would ask to be increased 15.1%. And then our revenue will be decreasing 7.7%. We'll delve into the expenditure authority a little later in the presentation, but what I want to touch on right now is the decrease in revenue. The largest factor leading to this decrease in revenue for us was a change in the, we have some security contracts out at the county grounds that are going to be transferred over to the Wauwatosa PD. So we had about a $1.3 million decrease because of the elimination of those contracts. They should be eliminated or by April of 2022. So that's the main driver of our revenue decrease.
All right, and then I'll provide a quick update as to where we're at in 2021 that's underlying our request for additional funds in the 2022 budget. As I'm sure everybody on our call today has been following, 2021 has been a year filled with a number of public safety challenges in our community, which have directly impacted our patrol jurisdiction at the Sheriff's Office. We've seen throughout Milwaukee County an unprecedented number of homicides take place during the course of 2021. And tragically, several of these incidents, far more than we normally see, have impacted our county parks. Since September of 2020, we've experienced 4 homicides in our county parks. And each of those has resulted in an intensive effort to identify the individuals responsible so that we can bring justice to the families of the murdered victims. With that stated, we've also continued to see significant increases in reckless driving challenges on our expressways. I know that's a challenge that extends throughout Milwaukee County, including on municipal streets and roadways, but it's a challenge we've seen with great intensity on our expressways, resulting, unfortunately, in recent months in a number of road rage incidents involving the use of firearms, whether they've simply been brandished, whether shots have been fired. We've seen an uptick in these incidents over the course of 2021, and it's something that's resulted in a need for increased patrols and certainly a continuous presence of highly visible sheriff's enforcement on our expressway system to really try to prevent these incidents before they take place. Again, our agency is one that uses data very extensively. On a day-to-day basis, we're analyzing areas of our expressways and our county parks that are in need of an additional patrol presence due to upticks in challenges, complaints brought to our attention by neighbors who live near parks, as well as by motorists who travel in high volume areas of our expressways. That also factors into our deployment strategies and is something we take into account daily. Another significant factor in our budget ask this year is the ongoing reform of the county jail, which I've already spoken to in part. However, over the course of the COVID-19 pandemic, jail operations have been subject to constant change. We are working very proactively to head off threats to the persons in custody at the jail associated with our current pandemic situation. That means that we're constantly analyzing data, we're constantly looking at how the pandemic is evolving, and we're making significant operational changes accordingly. For a very long period of time, we operated the jail under single cell housing, which means that in a facility that at a maximum capacity can house about 960 to 990 individuals, 960 under a legal mandate that the county has been under for about 20 years, and then 990 under the basic operating capacity of the facility. We were actually operating at about 300 individuals less, with about 650 to 700 individuals in custody, which allowed us to house every individual in the jail in a single cell. And what we saw with that change was really an increase not only in the safety of the individuals in custody and in their ability to have space to themselves, which I think accounted for a decrease in interpersonal conflict in the facility, but it also really helped stop the spread of COVID in the facility before we got to the point of having vaccinations available. As we've gone into this summer, for a variety of factors, our population has once again increased to a point where we can no longer ensure single cell housing. But with that stated, we are continuing to engage in extensive reform efforts that accompany, and I apologize, there's I've got to address something real quick. I apologize. My apologies. There is something taking place outside of my office. I'm sorry for the interruption. Back to where we were. In addition, as I mentioned earlier, the jail has, for the first time in its history, attained accreditation from the Blue Ribbon National Commission on Correctional Healthcare, which is a significant step forward. On the sort of downside, especially as we've seen the job market open up, we've experienced severe challenges in our jail with the recruitment and retention of personnel. I'll be succinct because I know this is a challenging and complex issue, but to summarize it, corrections officers are only paid a starting salary of just over $20 an hour. That salary is not commensurate with what the professionals we employ are able to obtain from other employers. So we employ fantastic public servants as corrections officers who really have a passion for public safety and service in the field of law enforcement. But they're accepting jobs left and right at other agencies, other facilities, and unfortunately, increasingly in the private sector, because for the work that the jail environment requires, the pay is just not adequate. And so what we're attempting to do in our budget this year is increase compensation for these personnel. However, it's really a challenge that's ongoing. At present, out of about 261 budgeted corrections officer positions, we have only just over 175 of them filled due to the ongoing challenges with both recruitment and retention. Again, this year, as in prior years, we're seeking funds to support the expansion of accountability measures within our agency. We've not only invested in intensive training, so not only practical training for deputies and corrections officers to de-escalate encounters, ensure that everybody can walk away with their rights and dignity fully intact and respected, but we're also investing in training for our supervisors, both in the jail and on our patrol side of the agency, to ensure that they understand what they need to be doing to ensure that employees' activity is regulated and that it's accountable. We're also engaged very aggressively in policy reform. Our agency is in full alignment with the 8 Can't Wait standards for policy innovation in law enforcement and corrections. I won't go in step by step because I know we're short on time, but long story short, the 8 Can't Wait are a nationally recognized system of reforms, really kind of drawn into 8 categories, most relating to the use of force and its documentation, that many agencies throughout our country have adopted over the course of the last year. And the Sheriff's Office is in very close alignment with each of those categories. Specifically, we have within the last year banned the use of either form of neck restraint, either a chokehold or a carotid hold, both of which have been associated throughout law enforcement in our recent history with frankly with homicide, with the entirely improper use of force that's resulted in the deaths of individuals encountering law enforcement. And as a result, even though our agency had never allowed either form of force and had never trained either form of force, within the past year, we've explicitly banned the use of either and codified that within agency policy. Likewise, we've really regulated, again, our use of force reporting process to ensure that both our Internal Affairs Division and our Training Academy, which is responsible for offering insight into whether uses of force align with the state mandated standards for defensive and arrest tactics. And as a result, we've ensured that both of those divisions are more fully integrated into the reporting process when deputy sheriffs or corrections officers are involved in physical encounters. As we move into 2022, our priorities are very consistent. We're seeking the funding that we need to ensure security at our jail, in our courts, at our airport, to proactively patrol our expressways and our parks, and to conduct investigations efficiently and in a manner that brings violent offenders the accountability that they need. We also are deeply committed and will continue to be committed to advancing the reform of the Milwaukee County Jail, ensuring safety, and investing in professional excellence. That also means that we're going to have to address not only the recruitment and retention gap, but the staffing challenges that exist within our facility, some of which pertain directly to positions that are not budgeted, but that any jail facility needs. So very briefly, our jail facility is a rare facility that does not have an intermediate level of frontline supervision. We have a jail commander, we have captains who run each shift in the jail, and then we have lieutenants who run different areas within the facility. But unlike most facilities, we don't have sergeants who provide direct frontline supervision to the officers who work in each housing unit in the jail, who manage the booking room at the jail, and who manage record services at the jail. That's a significant gap, and it's something that has not been filled in prior county budgets. And it's something that recently the Milwaukee County House of Correction actually innovated with at their facility. And it's something that we're kind of following suit with in this fiscal year. That's actually cost neutral. So you won't see that in our upcoming slides about major changes in the upcoming budget. But an additional gap that we have is, unlike many state prison facilities and other correctional facilities, we do not have a deputy jail commander responsible for the day-to-day operations. We have a captain who functions in that role, but no budgeted position for it. And so that's a change that we're seeking in this budget, and it's a gap that we're currently experiencing in the facility. So I will now defer again to Administrator Caravetta to discuss really the fiscal mechanics of the changes that we're seeking to effectuate in the 2022 requested budget.
And just to interrupt for 1 second, we're 5 minutes over time, so we're going to have to ask you guys back, but please wrap up. And I don't want to cut you off here, but we'd love to have you back at the task force to hear more in depth. And I'm sorry that this went over.
Should I just try and run through it real quick?
Yeah, we'd love to. Yeah, we'd love to hear it. I just had to give whatever minute warning. Thanks.
I'll be as brief as I can. It included in the 2022 budget, we had $2,025,886 added to our budget for the Deputy Sheriff Associations. They settled a contract for the 2019-2020 year. So the adopted budget for 2021 did not have those pay increases in it, but 2022 does. So this is what those pay increases has increased our budget by. As Ted mentioned before, we have $1 million, $7,197 for correctional professionals to be used for pay increases and movements in the pay range. Again, as communities around us are they're outpacing us in pay, we're losing some talented, experienced people, and we need to correct that by getting pay increases. We are also building out our body camera program by $500,000. This is critical for accountability in our area. Cameras are definitely, proof of what's going on with individuals in certain areas, and an extremely good tool for the sheriff's office to have. We've also added 12 positions to ensure accountability. They're in accounting, correctional leadership, community-based policing, and correction services. That was about $758,339. We also, I'm moving on to the next slide real quick, Ted. We had, besides our operating budget, we are asking for some items in our special projects in our capital request. There's $171,532 for some renovations in the jail. We are increasingly getting more people with special needs, and we need to build out a little more room to accommodate those people. We've also asked for $1.3 million for cameras in the parks and throughout the courthouse facility. As had mentioned before, violent crimes are increasing. Cameras are a good deterrent to capture what's going on in the parks, what's going on in our courthouse facility. And it's a good tool for us to have to capture more of what's happening and then responding quicker to it. And last but least, we have a little over $1 million in a request for a roof repair. The training academy down in Franklin is the building that we maintain. It's an excellent facility. While our training goes on down there, you could have training classes down there. There's a lot of specialized equipment down there. So this is something that is just a general maintenance that has to be taken care of. Hopefully I did it quick enough.
Thank you for putting your emails up. Congratulations for the NCCHC accreditation. I don't know if people realize how tough that is to get, and that's amazing that you did it, and your commitment to CIT training and mental wellness in servicing the public. I think we all really appreciate that. Okay, so wrap up. I got to do this really quickly. Calls to action and next steps. Everyone get involved with the county budget process. We've heard everyone talk about the challenges that they're facing. There's still more opportunity to get, oh, Mary is here. Okay, there's still more opportunities to get involved. So please look at our website. Barbara has put in some, the budget town hall meetings that everyone can attend. You can reach out to your county supervisors, tell them what your priorities are, and advocate for your agencies. Mary, did you want to say some things?
No, I would just like to thank everybody for their wonderful presentations and their commitment to our county and our citizens, and for everybody for attending today, and for the excellent questions. And thank you very much.
Thank you.
We'll send out some follow-up emails with the link to the recording. We really appreciate all of our presenters and helpful PowerPoints. Those are all posted on our website, so are available for you to review. And we will keep you posted as the county budget process moves forward on opportunities for public input, including, supporting the CART team and some of the other positive things we heard about today from our speakers. Thank you.
Thank you.